Hi everyone and welcome to Allied Health 102 Introduction to Phlebotomy. This is the lecture video for day one. As most of you are aware, if you're seeing this video online, it means we are home due to some type of event, whether it's weather related or pandemic related or something. Because Allied Health 102 Introduction to Phlebotomy, both lecture and lab, are not taught online. The reason we don't teach these classes online, guys, is because first and foremost, you take these two classes right before you go to hospital clinicals, which is Allied Health 211, and you have to actually go during the day to the hospitals. So at this point in your career path, if you're not able to attend classes during the day, then it's going to make it, then it's going to be hard for you to attend clinicals. That's the first thing. The second thing is we're making you a nationally certified phlebotomist that can work anywhere at any facility in the nation. But BITSI takes pride in their phlebotomy program, and we want to make sure that we're producing the best, most professional phlebotomist we can. And you cannot do that over the internet. I cannot teach you how to put a needle in someone's arm over the internet. So we are a Tuesday, Thursday as far as lecture is concerned. There's only one lecture class and it's 9:30 to 10:45. And so we all come together for lecture. So we have to have this class on campus for those two major reasons and more. But let's get started today, because the reason we're putting this online is because, again, like I said, something has happened. We're home today. However, we do not want to get behind because we have a lot to learn and a short time to cover it. So the first thing I want to make you understand is for when you want to know about your lecture assignments. For lecture, when I see you in class, when we get together after this event, I will hand out to you in lecture a small white binder. And then hopefully you've been able to get, or you're in the process of trying to get, your phlebotomy book, which is a baby blue color. It's called the Phlebotomy Handbook. Now, that phlebotomy handbook can be electronic, it can be new, it can be used, it can be rented. I think I would avoid renting if I could, strictly because you can use that textbook as a way to study for Allied Health 211. You can use it to help study for the ASCP exam. However, if you need to rent it for whatever reason, we can make that work. So in that small white binder that I'm going to hand out to you the first day I see you in class will contain the study guides, okay? Because my tests come directly from those study guides. Once you have that binder, your job is going to be, we're going to go through it in class, and then you're going to take that binder home, and you're going to put tabs with the chapter numbers and tabs for all other papers that are located inside that binder. You're going to put your name with a permanent marker on the front outside part of that white binder, and on the inside you're going to write your name. And when we have our first test, you will turn that binder in, and honestly, you will turn it in every time we have a test. But the first time you turn it in, I'm grading you on two things. One, did you fill in the blanks of the study guide? I'm literally giving you points for filling in the blanks on the study guide, which the answers are I'm going to give you in class when I lecture. Also, they're located in your textbook. All you have to do is fill in the blanks. I'm incentivizing you to fill in these study guides. Why? Because I want you to study them, because my tests come directly from these study guides. These are the things you need to know to be a professional phlebotomist. If you have your textbook or you have access to your textbook, please begin reading chapters 1, 6, and 7. Those are the first three chapters that we will cover in the classroom, and your first lecture test will be on chapters 1, 6, and 7. Okay? While you're reading those chapters and while you're in class and I'm going over these things, you will be filling in your chapter review questions. Now remember, there are going to be some chapter review questions listed on your study guides, and you will see that when you get them, that have asterisks by them. They're information that you need to study, and it will be on the test, but you do not need to answer them. I briefly touched on this, and we'll go over all your bonus opportunities when we see each other in class. But a few bonus opportunities I want to bring up is you can write, and you need to type it up, a personal essay, 1 to 2 paragraphs long. It's worth 1 bonus point. I realize that's not a lot of bonus points, but I give you a lot of chances at this. Why do I want you to write a personal essay? Because I care about you. I want to get to know you. I want to build a relationship with you so we can work together as a team to get you through to your CTS in phlebotomy and passing your ASCP certification exam. Find my office. You get a bonus point for finding my office. My office, and we'll see my office hours and all my contact information shortly, but I am in Building H. That's the building closest to Texas. It sits off by itself. I am in room H120. It's on the first floor. You get a bonus point for coming by there. Now, whether I'm in that office or not, what you're going to do to get this bonus point is write your first and last name and Allied Health 102 on a scrap of paper, a sticky note, I don't care, and you're either going to hand it to me or you're going to slide it under my door. And when I find it, you will get your 1 bonus point for finding my office. Why do I make you do this? Because I keep my office hours. And my commitment to you is that I am giving you study guides. My tests come directly from those study guides. I'm going to give you all the information and tools you need to be successful. I'm also going to be there for you anytime you have questions, comments, or concerns. So I want to make sure you know where my office is at. But remember, that's the things I have to do. You have to study at home. If you do not put in the hard work and the time at home, it will make it very difficult for you to be successful. I give you 5 bonus points for putting your picture on canvas. It needs to be a face shot of only you. Why do I do this? Again, same thing with the personal essay. I want to get to know you. I want to learn your face. I want to learn your name. Okay? So though we have other bonus opportunities, and you will have a sheet to help you keep up with your bonus opportunities, and I will give that to you the first day we meet. Now, I also have a video up for lab number 1 in the lab Canvas course that talks about the first day of lab. So make sure not only do you watch this video between now and the first day we meet, whether that's Tuesday or Thursday, please make sure you go to your lab Canvas course, and under the modules, there is a lab video number 1, along with some other videos that you need to watch under that same header. Please watch that video as well, because it's going to talk to you about reading about professionalism. That's in chapter 1. Those chapters will be located in the big lab white binder that I'm going to give you on the first day, but I want you to be aware, you can go ahead, if you can, and on your Canvas course, you can see and pull up and read chapter 1. Just pull it up on the screen. You will see it under your workbook pages. They're all listed in Canvas, and you can pull it up and read, and you can read about professionalism to kind of get yourself ahead. When you come to class and I give you your binder, you will have the worksheet page you will need to complete for homework. You will also, we will go over practicing tying the tourniquet. I will show you how to do it, and then you will practice doing it on the practice arm, and then you will have a worksheet that you take home with you to practice doing that yourself. There's also a good video, not just the lab 1 video in your lab Canvas course, but also how to tie a tourniquet, phlebotomy equipment, and donning and doffing of your PPE. Please watch all those videos before you see me in class next. Now, hopefully everybody knows how to use Canvas, and get onto BPC's website, bpcc.edu. And it looks a little different than what you're seeing on the screen here, but across the top are the little tabs, and there's one for Lola. That's where you can go and print out your schedule and make changes to your account. And then there's My BPC. My BPC is the one you click on, and it takes you to a sign-on screen where you use your Lola username and password, and you sign on, and then that is where all your Canvas courses are housed. Now, this class is a face-to-face class that meets on Tuesday, Thursday from 9:30 to 10:45. The only reason you're watching this video now is because, again, something has happened that has unfortunately put us at home. But we can't not do this because we don't want to get behind. Remember, sign on to all of your classes, whether they're in person or online. Do that the first day of class. Not only do you need to do that because if not, on some of your online classes, they will drop you from that class if you don't do it. But even your in-person classes have a wealth of information on that Canvas course to help you be successful. Once you go to your dashboard, you can click on whatever class it is that you want. And this is an example of ours, our lecture and class. There'll be information on me. There's a simple syllabus tab over to the far left-hand side that you can click on to see your syllabus, which has all my contact information as well. And I'll go over that with you. But there's a button that you see there that says Start Here. Click on that and it'll take you through it. Again, it'll open up. Again, chapter reviews and study guides are listed in here for both lab and lecture. So please make sure that you go on there if you need to look at something. You do not have to print it out. That stuff will be given to you in the classroom when we meet. But reading about professionalism under your lab modules, you can do that at home now. And that way you'll already have that done and you can easily complete that homework. Remember, class begins on time. Please be prompt and don't miss class. Remember, like I said in lab, this isn't just a class, it's about your professional career. And we talked about making arrangements for someone to help you with your children if they're sick, backup transportation unless your battery dies or you have a flat tire. Also, scheduling appointments such as doctors, lawyers, outside lecture, and lab time. I'm not going to schedule any of my appointments when I'm supposed to be with you. I would appreciate it, and it would help you be successful if you did the same. Guys, set 2 alarm clocks if you have to. Some people are bad about not wanting to get up. We want you to get up. We want you to get to class so that you can be successful. Now, let's talk about this. Books needed for lecture and lab. The phlebotomy handbook. You will need that for lecture. You can, like I said, electronic, used, new, rented. I will hand out a big white lab binder to you the first day I see you. And I will hand out, it won't be black, it'll be white, small binder with your lecture study guides in it. Okay? So those are the 3 things that you have. 1 for lab in the center, the 2 on the outside are for your lecture class. Now, make sure you must recertify in CPR if your card will expire before the end of clinicals. And we'll talk more about this when I see you. It cannot expire in December and it cannot expire in May. It cannot expire when you are in clinicals. Parking, when you guys come to campus, do not park in areas with yellow lines or areas designated for faculty and staff. They do give out parking tickets and you don't want one, okay? See me after class if you have several college hours or if you've changed your major or you've transferred over stuff. Let's make sure that you're not on track to get an Associates of Science degree. And we will talk about you furthering your education as we move forward. Next semester, if you pass all your qualifying courses with a C or better and you take care of all of your non-academic stuff, you will go to clinicals. Start trying to think about the money you're going to need, and we do have some resources to help you, but you're going to need titers, you're going to need blood drawn, you're going to need a physical, things like that. It could be anywhere from $300 to $400. If you start now, you can make sure that you put some of your school money back for that. What must I do to get into phlebotomy clinicals? I get asked this all the time. First, you have to take or have taken your qualifying courses, which include what we're in right now, Allied Health 102 lecture, along with Allied Health 102 lab, which is Intro to Phlebotomy, Biology 110, which is Medical Terminology, Biology 120 and 120L, which is Intro to A&P, and Allied Health 109, Healthcare Systems and Safety. Once you pass all those qualifying classes with a C or better, then you can go to clinicals. Now, since COVID, we have not had a problem with not having enough spots for people, but that is going to eventually change, and there will come a time when we have more than 15 people vying for those 15 slots to go to clinicals. It's happened before. What we do then is the people with the highest GPA in their qualifying courses make it into clinicals. If you have questions, comments, or concerns about that, we can talk about that in class. All clinical meetings are going to be held on Friday afternoons. Okay? I will get with you and have you a detailed schedule on the first day we meet on any clinical meetings that we have, the date and time and location, so that very early on you can go ahead and make arrangements to be at those mandatory meetings. The syllabus, again, you can go online over to the far left-hand side. There's a tab that says Simple Syllabus, and you can click on that syllabus and you will see the syllabus with lots of nice links that you can click on and take you right where you need to go, right? And the tentative course calendar. I will hand you out a hard copy the first day I meet you as well. Okay, there's my information. I'm the program director for phlebotomy. I'm assistant professor at BIPSI. I have a master's in public health, and I am a medical laboratory technician. I'm an ASCP certified MLT. If you need to call my office, there's my office number, okay? Or my cell phone number. Yes, I actually give out my cell phone number to my students. Please don't make me regret it. We have rules around that cell phone, okay? If this is just an everyday question that you don't need an answer to right now, the best thing to do is email me, okay? mshepard@bpcc.edu. You see it there on the screen. I check it once or twice, usually twice, every day, okay? More than that sometimes, Monday through Friday, okay? So if you send me an email about something, that is the best way to do it if it is not an emergency, okay? Now, I typically don't answer emails over the weekends, and I will not answer emails when I'm in class. So if you're running late for class but you're on your way, email is not the best way to do it. Why? Because I'm in class, right? And that means I will not check my email until I finish all my classes and I'm down in my office. So if it's an emergency, you want to text me, okay? Because I'm not in my office, so calling my office number wouldn't work either, okay? But you can call my office number during my office hours. I would prefer that if you're calling me during my office hours, please call my office phone, okay? If I'm not able to answer because I'm on the other line or I'm with the student, leave a voicemail for me. Please include your name, first and last, your student ID number, what class you're in, and a brief description of your issue, okay? Now, if you're running late for class or if this is an emergency, then yes, text me, okay? And then I will decide if you and I need to talk, and if we do, I have no problems with you calling my cell phone, and we will talk, okay? Again, my office location is Building H, room 120, okay? Let's talk about some course requirements. To pass the course, this is important that you know what you need to do to be able to pass this course. You need to make a 70% or better on your finger stick and venipuncture skills test. That will be in lab. That's part of your lab grade. In lecture, you will need to make a 70% at least, right, of 5 of the 10 case studies. You will have 10 total case studies. 5 of them you must pass with the 70% or better to get out of this course. That's for lecture. For both lab and lecture, you need to make a minimum grade of 70% or better on all tests, including your comprehensive lab and lecture final. And for lab, all your workbook pages need to be complete, and we will go over in lab when I see you exactly what I mean by that. Attendance. Y'all, this is not just a class, this is a career. This is a profession. Okay? And these are the things you need to know to be a professional phlebotomist. You cannot become the best you can be, which makes you more impressive to the people at Ochsner's and it will assign if you're not attending class. You need to attend class. Class begins on time at certain, not immediately, but within 5 minutes of me starting class, I will close and lock the door. That's a BIPSI policy. If you're more than 5 minutes late, without texting me and without a valid reason, you will be counted as absent. Now, if you wish to withdraw from a course, you must do so officially in admissions in our office in Building F. Any student who ceases to attend class will be subject to a college-initiated withdrawal. Now, what does that mean? That means when a student misses 2 weeks of class or 4 times, the student will be removed from the class and will receive a WN for the course. Now, there are exceptions, and they are very rare. But here's where the problem lies. If you're not emailing me every time you're going to miss class, then I won't know what's going on with you, and I cannot help you. It is vitally important that I communicate with you, and it is vitally important that you communicate with me. Now, let's talk about makeup test, okay? So here's the deal. I no longer require doctor's notes if you just miss class. However, if you miss a test, you need a doctor's excuse, okay? If you miss a test, you need a doctor's excuse. Not only do you need a doctor's excuse, if you miss a test, it is your responsibility to let me know you're going to be absent that day. Then it is your responsibility to look at my office hours, pick a date and time that works for you within 1 week of missing that test, and emailing me. Please email me. Why? We need a paper trail. Also, I need to look at that date and time when I'm sitting at my desk so I can pull up my calendar, make sure no one else is on that time slot, and then if I am free for that time, I will put you on the calendar, and then I will respond to your email. Now, up to midterm, we will do makeup test in my office. After midterm, I'm going to have one specific day that anybody that has missed a test will be able to come to that one specific day and time to take any makeup test they have. If you don't get to do it then, you will have to make up your test when you take your final. Okay? Lab worksheets and makeups. Y'all, it is almost impossible to make up these labs if you miss them. We will go over in class what you need to do if you miss lab. Y'all, lab is your hands-on experience of learning how to be a phlebotomist. You're going to be nervous when you go into clinicals and you have to stick people for real. If you miss lab class, it's going to make you even more anxious. And it's going to hurt you because you're not going to be as impressive as you'd like to be. Course calendar. What's that about? There's a tentative course calendar, which means we try to stick to it as much as we can, but I'm never going to rush through a lecture. If people have questions, I'm going to stop and answer them. I will never move a test up. I will always move it away, and we will always discuss it ahead of time. But it tells you when is your first lecture quiz. It tells you what do you study, right? What do you study? You study your study guides. There's going to be study guides for both lab and lecture, okay? It's going to tell you when your first lab quiz is. It's going to tell you what to study in lab. It's going to tell you when is your first lecture test, what to study in there. It's going to have everything listed out for you. There's 13 Canvas quizzes. We'll talk more about these in class. They're very important because they help you with that 70% overall average grade. The tentative course calendar is set in stone when it comes to these Canvas quizzes. It tells you when they open, which ones are opening, and when they close. They also alert you on Canvas, so if you're checking your Canvas class at least once to twice a day, whether it's an in-person or online, you're going to catch this kind of stuff, and you're not going to end up not being able to take this little 10-point quiz as many times as you like until you get a perfect score, right? If you miss it. This is the only in-person quiz, you will have tests, but quiz that you will take in lecture. This is the profiles and panels quiz. Now, I'll show this to you, and I'm going to hand you out a colored copy of this in class when I see you. This is exactly what the answers are. And I have them color-coded for a reason, and we will go over this in class. This is located in your Canvas courses, okay? I give this quiz, I talk about this quiz on the first day because, as you see, that's the first page, that's the second page, that's all the answers. I give you the answers to the quiz. I also give you a blank sheet that you can go over to the library and make copies of so that you can study the profiles and panel answers, put it out of the way, and then practice writing them down to make sure that you're getting it. I tell you about this quiz on the first day because this is what the quiz looks like. It's a lot of blanks. And people have a tendency to have anxiety and panic when they think they're going to have a fill in the blank test. So we go over this now. I will hand out both the answers and a blank one to you in class, and you also have access to more answers and blank ones on your Canvas course. So let's get started, guys. So if you can, please, if you can, and some of you may not be able to, but if you can, print out your Chapter 1 study guides for lecture. It would be nice because then as I'm going through this, y'all could fill in the blanks. If not, I will help y'all get the blanks filled in when you come to class and I hand you out your binder. But if you're capable of printing out just Chapter 1, nothing else, then this would be good for you because you could sit here, watch this video, and then fill in the blanks. Make sure you're watching your videos on Canvas. There's also one on there about what is a phlebotomist. If you're going to be one, it's good for you to know what one is. Guys, these are our learning objectives. They're very important, okay? Because these objectives, goals and objectives are important. Now, I want to tell you, so if you decide one day you want to do something, right? Let's just say you decide you want to run a 5K. You've heard people doing it before. Let's just say they have a turkey trot or a Christmas run downtown, and you and your friends have always wanted to do this and mark it off your bucket list, right? Well, if you've never ran before, you're not going to run out there and try to run 3 miles, just jump off the couch and do it, right? You're going to run for a minute and then walk a minute, and then maybe the next day run 2 minutes and walk 2 minutes, right? Think of that training, that slow, methodical training that you do until you can run 3 miles as your objectives. And your goal is to run the 5K. So our objectives for Chapter 1, these are the things that after reading Chapter 1, after filling in, coming to class and listening to lecture, after filling in your study guides and studying your study guides, these are the things that you should know. And it's important that you know what your objectives are because this is what I'm expecting you to know. Now, I'm not going to read these to you. They are also listed at the front of each and every one of your chapters in your phlebotomy handbook. Here's the rest of them. And again, like I said, I'm not going to read them to you. They're also listed at the front of your textbook. Now, let's start here with, so like I said, Chapter 1, right? So while I'm lecturing in lecture, you will see the slides that look like this pop up. These are those critical thinking, higher learning activities, okay? I do these because we have found out through the research that doing it this way is how you actually lock this information into your mind. And remember, until you get this foundation of knowledge, you're not going to be able to critically think scenarios through that you're dealing with out in the real world. Now, what do I mean by that? You're going to have 10 case studies, remember. You have to pass 5 of them with 70% or better to pass this class. Case studies are scenarios that as a phlebotomist you might face when you're out there working. I want to make sure that I give you all the knowledge you got that you need in both lab and lecture to critically think through that scenario that you're faced with as a phlebotomist, and you're able to come up with the best solution for you and your patient. Okay? Now, again, these are designed to help you remember new information and to think so you can put it together with older information. This is not a test, so you're welcome to peek at your notes when you see these critical thinking slides. Now, let's get started. You'll see number one, right? There will be a number one in your white lab binder, and of course they're online too. And like I said, if you can print them out, that would be great. Just chapter one, because there'll be a one and there'll be a blank, okay? And that blank is for you to fill in clinical decisions, okay? Clinical decisions are based on medical standards of practice. That's the first thing they have. They have some medical standards of practice. Okay? And they use those medical standards of practice along with diagnostic testing, like lab. That's easy for us to understand because we're part of the clinical laboratory professionals, right? They use lab tests, but not just lab tests, x-rays, MRIs, and other things. They use their patient's history. And then they observe signs and symptoms that the patient tells them about or they see when the patient is there, including their height, their weight, their temperature, their pulse, their respiratory rate. Okay? They put all of those things together and they use that to make what we refer to as a clinical decision about what is possibly wrong with their patient or what is wrong with their patient. Therefore, before physicians can make decisions, they need laboratory test results. And it is the phlebotomist who draws the blood for these tests. So you can understand that if that sample is not a good sample, then the results we get from that sample will not be good, which means the doctor is making clinical decisions about his patients off of not great information, right? So we know that we're a valuable part of the healthcare team and we need to do our job to the best of our ability. Now, let's talk about those people who perform phlebotomy, okay? Lots of clinical laboratory personnel do. I was not a phlebotomist, but I was taught phlebotomy and I performed phlebotomy in the hospital. Because as a medical laboratory technician, I was working nights originally and we only had one phlebotomist. So if that phlebotomist was up on the floor busy and they needed something else drawn in the emergency room or ICU, then one of the medical laboratory technicians had to go and draw that patient's blood. We know nurses draw blood, nurses' aides, respiratory therapists, medical assistants, and other home health personnel and others, okay? Now, I will say this, some doctors draw some blood, but that is not something that doctors do. They are the ones who probably perform phlebotomy the least. Here's one of those slides, right? What am I trying to do? I'm trying to get you, this is new information you're learning, then we will come right back and make you pull it up out of your head. Guys, here's what we know from the research. Just reading something over and over and over again is not going to make it lock into your brain and make you actually learn it and remember it for most people. For most people, you do need to do that part, but then you need to put that away and have somebody quiz you. Because literally you sitting there and having to pull that information out of your mind is what is going to lock it in there and make sure you know it. So when I put that test in front of you, whether it's my test or a test in Allied Health 211 or whether it's the ASCP exam, that is how you're going to learn. Study, 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 put it away, have somebody ask you the questions. So here we see you work in a doctor's office as a phlebotomist. You work with a doctor, a nurse, a medical assistant, and a clinical laboratory scientist who runs all the laboratory tests. You call in sick one day. You tell the receptionist, there's one person I work with that you probably don't want drawing blood today because they so rarely draw blood. I want you to try to pull it out of your mind and guess who that one person is. The doctor, correct? I know this one is a simple one, right? We're just getting started. But when you're at home studying, forming study groups with some of your lab partner or one of your classmates, or getting someone that you live with to call these questions out to you and make you have to answer them. That is the way you're going to lock that stuff in your mind so the day of the test you will actually know the answer. Let's talk about phlebotomy practice and definitions. We need to know what the definition of phlebotomy is, right? It's derived from a Greek word, phlebo, which means veins, and tomy, which means it's related to cutting, right? So you kind of cut into a vein, right? In this case, it's with a needle. Okay. Um, it's also venesection is another word. There's other words that's synonymous with bloodletting from a vein. Okay, but make sure you understand the definition of phlebotomy. Okay, and what those parts of that word mean. Now, the phlebotomist or blood collector is the individual who must often perform phlebotomy. As a phlebotomist, your main job is to perform phlebotomy, which is to draw blood. But that's not your only job, right? Phlebotomists also assist in collection and transportation of specimens other than venous blood. It may be arterial blood. You may collect skin punctures, which would be capillary blood. You may collect and transport urine. You may be in a room where they collect tissue and then they send the tissue with you down to the lab, sputums. Um, you also will perform other clerical duties like entering patients into computers and things like that, and some other technical functions. But your main job is drawing blood. And we want to make sure we do that primary job as best we can because we want our results and everything that we do to be accurate, to be safe, and to be reliable. Not just in the collection of the specimen, but the transportation of the specimens as well as we take them to the lab so they can be analyzed. So you go to work at Christus Highland in the lab as a phlebotomist. What do you think your primary duty will be? Guys, while you're watching this at home and hopefully you were able to print out chapter 1 from Canvas and you're filling in these blanks, like I said, if you're not able to, we'll get that taken care of in class, but it would put you ahead of the game, right? You can pause these videos and then see if you get the correct answer. We went over this, right? Although you have other duties, your main duty would be collecting blood, whether that is venous, capillary, and on occasion, depending on where you work, arterial. We're still talking about phlebotomy practices and definitions. So let's get into diagnostic testing, therapeutic monitoring, therapeutic assessment and monitoring. Why do we analyze blood specimens? Why do we even do this, right? Why do we analyze these specimens, including blood? Because first and foremost, okay, we want to figure out what's wrong with our patient. We do diagnostic testing to figure out what's wrong with our patient. Then there's things called therapeutic assessment. We decide on appropriate drugs or treatment based off these lab results. And then we monitor our patient to make sure whatever therapy or medication we gave them is alleviating the disease. And we'll get more into that monitoring, assessment, and testing, right, as we go through. But you need to understand that the three purposes of laboratory analysis of specimen is to diagnostic testing to figure out what's wrong with your patient, therapeutic assessment, you're assessing that patient, which is helping you decide on the appropriate drug and or treatment. And then once you put them on that drug or treatment, monitoring that patient to make sure you don't need to change medications, change doses, or whatever. Now, let's talk about technology and how it has enabled laboratory testing to be performed closer to the point of care, okay? Point of care in some cases, okay? Such as at the patient's bedside or either at an ancillary site or a mobile site or in their home. Now, we're going to move on to now talking about healthcare settings, right? Because we're talking about phlebotomy jobs and you'll be working in the hospital, you'll be doing your clinical rotations in the hospital. Let's talk about healthcare settings and healthcare teams. Healthcare organizations can fit into two categories, what we refer to as inpatient or hospital care, where you've been admitted into the hospital, or what we call as outpatient or ambulatory care, where you may come in for a day surgery or for some blood to be drawn or a test to be run, and then you're going to go home there later that day or shortly thereafter. Inpatient and outpatient. Also, we want to go over the organized departments that are in the hospital. Now, why do you need to know this? First, you need to know you're educated about your profession so that you can speak intelligently to your co-workers, other physicians, and patients. Also, you need to know these departments so that customer service is a big deal, guys. We want to treat people as though we would like to be treated ourselves. We want to treat these people like they're our family members. So if they have questions, we want to be able to intelligently speak to them and help them realize that where this department is in this hospital, right? These are terms that you will need to know the definition to. Allergy, right? I know y'all all know what this is. Allergies, right? You can have an allergy to any type of irritating agent from pollen to peanut butter, right? There's anesthesiology. Anesthesiology is dealing with pain management. Okay? That's either before, during, or after a surgery. I know most people think of anesthesiology as during a surgery where they put you to sleep during surgery, but anesthesiology to also help you manage your pain before your surgery. If you're not quite ready for surgery yet, but you're in a lot of pain, they can help you manage that pain, and then after surgery until you heal. There's cardiology. We understand that they treat heart and circulatory conditions. There's cardiovascular, which is surgical diagnosis and treatment of heart and blood circulation. There's dermatology, okay, they treat skin condition. And there's diagnostic imaging and radiology. This is radiation for diagnosing and treating disease such as dyes. We want to know about these dyes. Why? Because some of these dyes can interfere with lab tests. Then we have electrocardiography, which is ECG or EKG, along with EEG, you see right below it. Both of these record electrical impulses. ECG and EKG record the electrical currents produced by your heart, and the EEG, electrical currents produced by the brain. Then we have endocrinology, treats those disorders of your hormonal system. Then if most of us should have a family or general practice doctor, they can care for all members of your family for minor disorders. And then if you have something that's beyond their scope, they can send you out. Gastroenterology treats disorders of the esophagus, stomach, and intestines. Geriatrics, we understand, treats the elderly. We have hematology, which treats conditions of the blood, and we have a department in the lab called hematology. We have immunology. We also have a department in the lab called immunology. Immunology treats conditions of your immune system. We have internal medicine that treats conditions of one or more internal organs. So if you have multiple diagnoses, they may take you from a general practice doctor and send you to an internist. And then there's laboratory medicine or pathology. Now this is important because it's the place where the phlebotomist brings the blood. This is where they analyze the blood and those other body fluids and tissues to diagnose, monitor, and treat your patient for disease. There's neonatal or prenatal. Uh, this treats premature and newborn babies and their mothers. Nephrology treats your kidneys. Neurology treats nervous system. Nuclear medicine is that radioactive isotopes or tracers that are used for diagnosis and treatment of patients. Again, you need to be aware that a lot of these radioactive isotopes may interfere with lab tests. Dietetics or nutrition, they just do nutritional analysis of patients that are inpatient and outpatient sometimes. They give patient education and they can place their patients on special diets. And then there's pediatrics that treat children. Now, I'm going to stop here. I'm going to go over this slide here. We're still talking about healthcare settings and healthcare teams. Guys, this is part of chapter 1. When all of us are together in lecture class, either on Tuesday or Thursday, when we're back on campus, we will pick up where we left off. Now, I will touch on some stuff, including the syllabus and the tentative course calendar and all of that in class. And anyone that was unable to print out chapter 1 and fill in the blanks while watching this, I will give you an opportunity to be able to fill those blanks in class. Remember, the answers are also located in your textbook, and I hope if you don't have it already, you work towards getting that, because my test, all of this is based on that textbook. It is a wonderful textbook with a wealth of knowledge, great photos, and it is really going to enhance your ability to be successful in this class. Once you get your textbook, you need to immediately start reading chapters 1, 6, and 7. Also, they should have a copy of the textbook in the Learning Commons, which is BIPSI's library in Building A. Check with them. They should have one. If they do, you can print for free. So you could go over there, and if it's going to be a week or so before you get your textbook, you could talk to the people in the library about making copies of a portion of chapter 1, just so you could start reading it until your book comes in. So to finish out here, psychiatry or neurology treats mental, emotional, and nervous system problems. Obstetrics and gynecology treat reproductive system of females. Occupational therapy is therapy for rehabilitative activities. Oncology treats cancer. Ophthalmology treats eyes and vision problems. Orthopedics treat bones and joints. And otolaryngology treats ears, nose, and throat, ENT, right? Now, again, we're going to stop here. We will pick up with chapter 1 when I see you guys in class. And if you have any questions, comments, or concerns, please do not hesitate at all to reach out to me. Email me, and I will be happy to respond. I hope you guys are staying safe, and I look forward to seeing you in class. Have a great day.